So tonight we're going to talk about Crohn's disease and CBD. One of the distributors asked me to present this information, and I think what's good um, when you email me and will request a topic, I think it's really good because you just never know. You may not have a client or a prospect with Crohn's disease right now, but now that you hear this information, you're like, you know what? Our products can actually help this person that I've just met with Crohn's disease. So Crohn's disease is quite debilitating. It is an inflammatory disorder of the intestinal tract, and it's very painful. It is life-altering, and it's a very, very difficult condition for us to alleviate symptoms and to treat in medicine. So this is why I think the conversation about our flat belly lifestyle and our CBD products are so important, because our products can help to alleviate some of the symptoms that we see in Crohn's disease. So as you can see on the far right is a picture of every single area of the intestinal tract that Crohn's disease can affect. You know, it is an autoimmune condition. And typically when you have an autoimmune condition, guess what else it affects? Yes, the joints in our body, causing a lot of swelling, causing a lot of pain, along with the fact that it causes a lot of intestinal tract issues. So even when we start with the mouth, because that's the beginning of our intestinal tract, right? Our mouth to our anus or to our rectum, it can cause sores in the mouth. It can cause inflammatory pain and discomfort, not only in the gut, but also the liver, the bile duct. It can cause a lot of painful diarrhea and constipation, which can cause rectal bleeding. It can cause ulcers. It can cause vomiting. It can cause abdominal pain. It can even cause a lot of weight loss and decrease in appetite, because folks who have Crohn's disease are just so miserable, they lose their appetite. And joint swelling, the joint swelling and the other conditions or symptoms is because it is autoimmune. It's the body thinking that these areas are foreign and starts to attack them. So it's chronic, it's long-term, and we're going to talk about how we can help those and assist those who have these issues. Fatigue, fever. We talked about stomach aches and cramps, sores in the mouth, painful joints and muscles. All of this is affected. So when we look at how CBD works and we talk about cannabis, we know from all of our prior talks that the endocannabinoid system is the system that explains how CBD works. And when you understand this again at this level, you're like, wow, that's why CBD probably is very helpful in alleviating and assisting symptoms that those who have Crohn's disease have. Why? Because the endocannabinoid system has receptors in major organs and glands. And one of the major organs and glands that affects Crohn's disease is the gut, is the colon. There are receptors in the colon that are looking for cannabis. It's looking for CBD. It's looking for those cannabinoids that the plant produces. We also look at the liver. See, the liver can be affected. The muscles, the bones can be affected in Crohn's. The eyes, and even the skin. So when we look at the overall receptors that are found in those major organs and glands, and we talk about even the central nervous system and the brain and the immune system and the peripheral system, when we talk about how many receptors are found in almost every organ and gland? Well, yes, this can assist someone with Crohn's that may have issues with inflammation and pain in their joints, or may have issues with a decreased appetite, or may have issues with sores and ulcers, etc., on their skin, because we know that these receptors are found. So there's a lot of research that has been done on CBD-based therapies to help alleviate Crohn's disease. In fact, CBD that is sourced from the hemp plant, like all of our products at Wakana, in 2018 was made legal. So now we're seeing research, we're seeing studies that now can be done on humans because it's legal in all 50 states. We are seeing a lot of research that is now showing that there are therapeutic properties and potential increased therapies that we can use to help alleviate Crohn's disease signs and symptoms. We know that the endocannabinoid system, because these receptors are found in the gut, it can help reduce the contraction of the intestines. It can help reduce the cramping. It can help reduce the pain. Also know that there are receptors that are found on the skin. Even those with Crohn's disease can have skin ulcers, etc. So lots and lots of studies that really show how CBD can be effective. Now, we can't make claims. That's one thing we cannot make, and that is a claim that this CBD will help cure your Crohn's disease. And I think that's really important that you remember that if you're on the line and you're a distributor, and even if you're on the line and you're a guest, that we can state that these products can assist with symptoms, but these products, we can't make claims will cure your Crohn's. But we do know, in order for the CBD to be even more effective, that following a plant-based diet is really helpful as well. So what I'm going to do now is I'm going to change my deck, and we're going to talk about Crohn's disease and plant-based diet. And I think that any chronic, any autoimmune condition, any comorbidity like hypertension, diabetes, multiple sclerosis, Crohn's, fibromyalgia, lupus, all of these conditions need CBD and a plant-based diet. We need to reduce processed foods. We need to reduce fast foods, fried foods, so that the inflammatory process that really causes these conditions to be debilitating to be decreased. Even when we look at high blood pressure, we look at heart disease, we look at diabetes, we look at all of the inflammatory conditions that affect our joints, like arthritis and sciatica and plantar fasciitis. The biggest thing that we're seeing is inflammation, right? So we can reduce inflammation, we can reduce the toxic environment. We can do that with a plant-based diet. So again, when we look at Crohn's disease, on the left is a normal intestine, right? On the right, you see Crohn's disease. The walls are very thick of the colon, of the intestinal tract. There are fissures, there are an increase in fat. All of these things cause an inflammatory environment. All of these things cause a lot of pain, and all of these things cause the muscle of the intestinal tract not to be effective. So that's why you have folks with Crohn's disease, they have both. They have diarrhea and they have constipation. Can you imagine having diarrhea one day and the next day you're constipated? So it's a wax and a waning of this horrible condition that your intestines go through. And with that, with constipation and trying to get stool out, what happens, you start to develop hemorrhoids, you start to have rectal bleeding, and really is a horrible, horrible condition. More than 700,000 people in the US have Crohn's disease. More children are now being affected with Crohn's disease, right? So eating a plant-based diet really is going to help to enhance the lining of your intestinal tract to heal, your gut to heal, the disease not to flare up as much, and to really address these symptoms. What happens when you eat a plant-based diet? Well, you're doing a lot. One, you are removing the toxic hormones and chemicals that we find in animal protein, right? When you're eating meat, chicken, fish, it cracks me up. And you've met the people, well, I only eat chicken and fish. Well, that's still animal protein. And those animals are still being fed toxic hormones and chemicals. You are ingesting all of that. All of that build up in the intestinal tract or the gut causes not only an inflammatory response, but also increases your risk for colon cancer. It's also a nidus for a cancer or polyps to develop. So plant-based increases your fiber. Fiber helps to move the food adequately. When you add juicing onto a plant-based diet, it helps your intestinal tract or your gut to rest, right? When you're eating food, your intestine really has to work harder. So, you know, our flat belly lifestyle introduces phase 3, introduces a lot of juice, a lot of raw salads, so that your intestinal tract can heal and it can rest. And you can increase your fiber. That's one thing that many carnivores don't get enough of, right? It's the fiber from vegetables. It's the fiber from fruit that they're missing. They're missing those whole grains, and they are getting a lot of toxic chemicals in processed food. So that's how plant-based diet really does help your gut. It helps your gut by, 1, reducing the inflammatory process. 2, it helps to move the muscles of the intestinal tract. The contractions are more efficient, decreases the risk of constipation, decreases the risk of diarrhea, and it really does help to improve the fiber amount in your diet. There are also other factors, good bacteria, the microbiome is important, probiotics, prebiotics, all of these very healthy and nutritional factors are found in fruits and vegetables. They're not found in animal protein and processed food. Reducing inflammation, reducing bacteria, reducing toxins, all of this can reduce pain, all of this can reduce symptoms of constipation and diarrhea. So fiber also helps to reduce, increasing fiber helps to reduce heart disease. It helps to reduce type 2 diabetes. It helps to reduce certain type of cancers. So there's a lot of benefits, not just for those who have Crohn's disease in having a plant-based diet, but for those who want to reduce their risk, prevent their risk, and even reverse their heart disease, diabetes, and cancer. So when we look at food, for those who have Crohn's disease, and we look at products that those who have Crohn's disease, we have 2 very great product lines. We have the Flat Belly Lifestyle, and we also have our CBD products. We have our topicals, our tinctures, our edibles, as well as our 7-day, and our 21-day cleanse. So is it possible to reverse Crohn's? Absolutely, yes. You know, there's some thought that Crohn's can also be a factor of genetics. It can also be environmental. But we do know that we can help those who have Crohn's disease to reverse their symptoms. Now, we can do that by one, educating them, right? A lot of people with Crohn's disease don't even know what's going on with their anatomy. We can also help them understand that a plant-based diet is very advantageous. So we can also remind them that there is a part of the cannabis plant that gives them the health without the high in reducing symptoms through the endocannabinoid system. So all of that is real science. There's no snake oil or magical potion to recommending a plant-based diet and recommending our CBD products to help reduce inflammation, to help reduce pain, to help reduce toxic chemicals, and really to help the intestinal tract rest by getting in more juices and to get in more raw salad. So now I'm going to move on to our product line. So when we look at our product line, you'll have a lot of recommendations for those who you meet that may have Crohn's disease, or those that you know even have diverticulitis, GERD, they may have reflux, they may have issues with diarrhea or constipation. We have a lot of products that can really help them. So let's talk about our tinctures. Our tinctures are, let's see if you can see the slide. Hopefully you can. Our tinctures are in 2 different formulations. We have a power and a pure. And what I love about the pure is that if you know someone that has Crohn's disease and has random drug screens, guess what? We have products that can assist and address those symptoms. Let's start with our power products. Our power products are in the black label. They have the word power, and they have the legal limit of THC, which is 0.3% or less. All of our products are sourced from organic hemp. They will not give you a high because of the THC, the Delta 9 percentage, which is 0.3% or less, which is legal limit in the United States. When the tinctures are introduced, even if someone has very long-term, chronic, debilitating Crohn's disease, start low and go slow. I never introduce a lot of CBD just because a person says that they've had a very long-standing stint with whatever condition, right? Most people don't need a lot of CBD. So start low, start slow, start with 3 drops under the tongue twice a day. Now, it's important that someone who has Crohn's disease start with the trifecta. The trifecta is the tincture, the topical, and the gummies, right? Because we know that Crohn's disease has not only inflammation that's going on in the gut, but they have a lot of abdominal pain. They have a lot of pain from the intestinal tract contracting, cramping, and they'll need that topical as well as the tincture and the gummy. So let's start with the tincture, 3 drops under the tongue twice a day. Make sure that they hold it under the tongue for 60 seconds before they swallow so that the tincture can really get absorbed and get into the bloodstream. Takes about 15 to 20 minutes or so before it gets into the bloodstream, but starting low and slow is the best way. The same holds true with the pure. The pure is our broad spectrum tincture. It has less than 0.0% of THC, will not show up on a urine drug screen. So it has a very special delivery system. It's called nanotechnology. In fact, A lot of chemotherapy medications use nanotechnology. It helps to improve the bioavailability that the cells are looking for. So 98.7% is the bioavailability. Start low and slow, 3 drops twice a day. We even have a water soluble. You can put it in your water, your juice, your tea, whatever is liquid. There are some people that don't like holding tinctures under their tongue. So the water soluble can be used that way. And then our hemp MD, that is our more potent product, 900 milligrams versus 300 in the pure, 500 in the power of CBD. It's a more therapeutic dose or dosing for those who have pretty severe conditions, right? Start low and slow, even though it is hemp MD, is a more therapeutic product. So those are the tinctures that you want to recommend for your client. The Power Hempranium is a very special product, like all of our products, and very unique because we have proprietary formulations on all of our products. We don't just sell you a bottle of CBD. We have enhanced our CBD with essential oils like black seed and turmeric and peppermint. Our carrier oils are MCT coconut and hemp seed oil, helping to carry the CBD into the cells. But the black seed and the turmeric also add that anti-inflammatory properties that we're looking for in the CBD. Black seed also helps to improve digestion. It helps to improve blood sugar levels as well. So this is a very important point that you understand that all of our products have proprietary formulas. And then again, the carrier oil, MCT coconut oil, also helps to improve digestion. So all of these factors are working to improve digestion, working to improve and assist symptoms that those who have Crohn's disease. This is our pure, again, 300 milligrams. Start low and slow, 3 drops twice a day, and our water soluble. We have culinary products as well. Culinary products are great for those who have Crohn's disease because they can use the CBD as they're cooking their favorite recipes or they're baking. But again, we want to ensure that they are following a plant-based diet. We want to talk about our smokables. Why? Because smokables act really, really fast. Within 1 to 5 minutes, smokables can really get into the system. So smokables can be added to the trifecta, right? I talked about the trifecta being the tincture, gummies, and topicals. The smokable, when you're having an acute flare, because those who have Crohn's, they have flares, just like those who have lupus have flares. Those who have gout, flares mean is acute onset. I'm like hitting my fist, right? Acute onset of extreme pain. And for those conditions and situations, you want to get something in quickly. So 1 to 3 pulls, either on our Delta 8 or our CBD, pre-rolls or vapes, will give that person some relief pretty quickly as the tinctures, the gummies, and the topicals are setting in. Even our Delta 8 is absolutely an option for those who have Crohn's disease because Delta 8 does give the body more and the mind more of a potency that is higher than CBD. See, Delta 8 is a cousin of Delta 9. So if those that you know who have Crohn's disease, like Delta 9, will use the Delta 8 gummies for them. Recommend the Delta 8 pre-rolls and vape for them as well. These are products that have a little bit more potency than CBD. The other edibles that we offer are our power gummies. That's our full spectrum gummies with the legal limit of THC. Again, for those who have Crohn's disease, we have the broad spectrum or the pure gummies so that they can pass those drug tests and still get relief with the CBD, as well as our flat belly brew and our flat belly gummies. Those are CBD products that really help to reduce weight and manage weight, and many of those with Crohn's need that as well. And then we have our other products like our immune defense tea, our bitter tea. All of these really can be utilized by those who have Crohn's. Our topicals, our 400 milligram Power Extreme Relief Cream, something they want to rub on their abdomen. Those with Crohn's disease not only have a lot of abdominal pain, but they have a lot of joint pain. It is an autoimmune condition. So you want to help them to know that they can use these products, even if they have random drug screens. These products won't pass the blood-brain barrier. Dr. Rita's Rub is another good topical for those with Crohn's disease. They can rub it on the abdomen. They can rub it anywhere that they're having joint pain. Crohn's disease, they have skin lesions, a lot of sores sometimes. So introducing the Power Mango Body Cream is great to help reduce the inflammatory process that's going on their skin. Their skin is affected. Their whole intestinal tract from their mouth to their anus is affected, and their joints are affected. So we've got some pretty incredible products that you can help them to understand and to use. And then we have our flat belly lifestyle products. I'm going to switch right quick because it's not on this slide deck. Let's look at our flat belly lifestyle products that you can recommend for those with Crohn's disease. You want to make sure that they understand that a plant-based diet is what they want to incorporate. You know, many times when you meet people with Crohn's disease, they have a pretty bad diet. They're eating a lot of fast food. They're eating a lot of fried food. They're eating a lot of meat. They're eating a lot of animal protein. They're eating a lot of dairy. Oh my God, all of that is going to continue to tear their stomach up. So you want to introduce them to our flat belly lifestyle products, like Flat Belly Lifestyle 2.0. We have 3 phases, but you want to introduce someone with Crohn's disease really to our phase 3 or our phase 2, a 7-day or a 21-day cleanse. That will really get them on the right track to get those toxins out, to address deficiencies, and to address dehydration. So the family of products that we're going to talk about in phase 3 is the eliminator, the purifier, and the cleanse. This 21-day process was life-changing for me. I started it on Christmas Day and ended it on January 16th. I got rid of 10 pounds of waste. I am now a raw vegan because of this process. I felt so good. I continued the process. I was probably the most unhealthiest doctor in the state of Illinois. I used to eat a lot of red meat, and I would get sick every time I ate a steak, but I continued to eat steak and get sick, and didn't understand that being a type A and being the blood type that really should be a vegan vegetarian, why I was getting sick, right? Never occurred to Dr. Rita that your body was just, was rejecting things that it shouldn't have in it. So for me, the clarity in my mind, the reduction in stress, all of that happened when I did my 21-day cleanse. And I feel amazing. You know, I am a person that works long hours, I work out, and I have more energy than I've had since I was 21. That was a good year when I was 21. So the phase 3 products also comes with a meal plan and coach. And for anyone that has Crohn's disease, diverticulitis, any intestinal tract condition, but we're talking specifically about Crohn's disease tonight, is a result of toxins in the gut. It's a result of the gut and body being dehydrated, and with that are deficiencies. And this process corrects all that. It corrects it through the juicing, the dehydration. It corrects it with the juicing and removing and detoxing with the herbs, the eliminator, the purifier, the regenerator, replacing minerals and vitamins that are deficient through raw salads and juices. All of those live nutrients are what's missing for the gut in those who have Crohn's disease. So highly recommend phase 3. There's also phase 2, which is not 21 days, but 7 days. Maybe the person just is not ready for 21 days. But again, I really, really stress anyone with an autoimmune condition, be it Crohn's, lupus, fibromyalgia, multiple sclerosis, needs to just embrace a raw diet, needs to detox for 7 or 21 days to get back not only the flora, the microbiome, but help to reduce the toxicity and help to reduce those bad bacteria that are in our gut. And we can really help a lot of people. You know, after they finish that 7 or 21 day cleanse, you can start them on the CBD products, the Trifecta, and add in the smokable. The Trifecta is the tincture, the gummy, the topical, and for those acute flares, when they have that Crohn's flare, that smokable. So hopefully you have a better understanding for Crohn's disease. Crohn's disease is a debilitating intestinal disorder affecting folks' intestinal tract from their mouth to their anus. It can also cause joint pain. It can also cause a lot of abdominal cramping, rectal bleeding, constipation, diarrhea. And I'm telling you, with the 21-day cleanse, they're just going to really thank you if they are on the constipated side to get that in order. And also our incredible CBD products are added to, and yeah, that dispensary, wellness dispensary package would be good for them because everything is there. They have their CBD products and their flat belly products all in one. Let's see if we can see that, because I did have that on a slide. Now, I think what I'm going to have to do, did you see my slide, Cheryl, or no?
Before, when you just took them away, I can't see.
Oh, okay. You did see my slides.
Yes.
Okay, wonderful. I was like, all this time you didn't see my slides?
Mm-hmm.
Okay.
I know someone with Crohn's disease, and they are in really bad shape, really bad. And plus, they're a smoker.
Oh my!
They have to carry around an oxygen tank. She is on the she on the deathbed right now.
What?
Really bad, really bad.
So, you know, anyone that is a smoker, anyone that's a smoker can absolutely alleviate the cravings for nicotine with our smokables. I've had multiple patients that each time they have the desire to smoke a cigarette, they just pick up our CBD joint and 1 to 3 pulls. And that helps take the craving away. So I'm glad you added that person with Crohn's disease is a smoker, because that reminded me to say that.
All right, thank you.
I do want to just add this for the distributors that are on the line, and that is the wellness dispensary. Again, this includes the cleanse as well as our CBD products. There's a wellness dispensary that again would be a great for someone with Crohn's, because it has the cleanse and the CBD product. And then of course, wellness starter dispensary would be great too for that person that has Crohn's. Get their education, get their cleanse, get their products as well. So, you know, don't be shy, introduce them to the business as well to get their health, wealth, legacy, and freedom back. Because I have 2 friends that have Crohn's, and and they're young, and it is very, very debilitating. So I'm going to take questions now. The way we're going to take questions, I think Anna, you have a question. All you have to do is raise your hand. And you can ask your question. You can just unmute your mic and ask your question. And let's see. And I'm so sad. Is Bernadine on the line? Because she's the one that asked me to do this presentation. But she'll have the recording if she's not on the line. No worries. Are there any questions? I don't feel the love tonight.
Hey, Dr. Rita.
Hi, Dr. Betty. How are you?
I'm awesome. How are you? I'm driving. But
Oh, okay. I can hear you.
Can you explain the difference between IBS, irritable bowel syndrome, and Crohn's disease?
So Crohn's disease is an autoimmune condition. So Crohn's disease not only has the GI or the intestinal tract symptoms, diarrhea, constipation, but it also has an autoimmune factor to it, joint pain, inflammation, dry eyes. It kind of acts like a lupus, but it also has the intestinal tract conditions. Irritable bowel syndrome doesn't have an autoimmune tied to it. Irritable bowel syndrome is just the waxing and waning of constipation and diarrhea. So Crohn's disease is autoimmune, irritable bowel syndrome is not. They both have the similar GI component, but irritable bowel syndrome doesn't have all of the other autoimmune conditions like Crohn's or symptoms like Crohn's does.
Mm.
Awesome. Thank you so much.
You're welcome. Any other questions? See, Anna, I saw your hand up. Anna Gallagher. I moved you to the panelist side. So if you have a question, you can ask. Shirley McLaurin, did you have a question? I thought I saw your hand up too. No, I guess Anna doesn't have a question. Toki Wheeler, do you have a question?
Yes, I have a question. How you doing, Doc?
I'm good.
All right. I have MS. Can MS replicate itself as Crohn's disease?
Not that I know of.
Or is it possible for an MS patient to have to autoimmune diseases?
Oh, yeah. It's possible for patients to have more than one autoimmune condition. Yes.
Okay, thank you.
You're welcome. You're welcome. Any other questions? Everyone's being shy. Nobody wants to come on to the other side.
I feel bad for my friend.
I do too.
Yeah.
I do too. You know, Crohn's disease is like any other autoimmune condition, meaning as it starts to progress and a person starts to decline, it could win the race.
It's pretty, she's in
And,
pretty bad shape, pretty bad.
yeah. And when you look at the unfortunate part that these people, out of all people, and we should all pay attention to our diet, but those people that have autoimmune conditions, those who have Crohn's, any GI tract condition, really should follow a plant-based diet, but they don't teach us that in medical school. So you're not going to have her doctor or his doctor talk to you about diet. The doctor is going to talk about all these medications I'm going to write a prescription for your Crohn's disease. But they're not going to talk about how you can reverse that with diet, how you can reverse that with, a plant-based diet. So I'm so grateful that Wakana, we have a platform where we can educate those about living a life free from animal protein and processed foods and fried food, and how all this has been tied to reduce not only heart disease, diabetes, cancer, and a lot of these autoimmune conditions. I am a firm believer that you can reverse disease with diet. And many of you know, and I told this testimony, that I saw it happen to myself. My blood pressure was elevated, and I reversed that with my diet, right? There were other things I had to do, right? There are other factors that cause high blood pressure, right? You got to get your sleep. You have to reduce stress, and diet. Well, I'm a big proponent of exercise, but it's just not a one. It's not just a one key component. It's like the cannabis plant. It's an entourage effect, right? It's an entourage effect. It's a combination. And that's why we call it holistic medicine. Holistic meaning mind, body, spirit, right? We've got to include all of that along with our CBD products and our flat belly products and all of that, right? So very grateful that we have the knowledge, because a lot of you on the line are wellness coaches. And if you're not, you're on these Zooms every week. You have the knowledge now that you understand that there are products that we can offer to everyone, because everyone has an endocannabinoid system. And so if everyone has an endocannabinoid system, they're going to respond to our products. Oh, Iola, yes, you can ask a question.
It wasn't pertaining to Crohn. That's why I wanted to know, would I be out of place to ask a question?
Sure.
Okay, it's regarding I believe it's CVT of the stomach. And I'm not quite sure if that means like a blood clot in the vein of the stomach. And they was wondering if they could still detox, using the detox.
CVT of stomach. I don't know what a CVT of stomach. So
So let's put it
cerebral
this way.
venous thrombosis and ulcerative colitis. Wow. So that's what it sounds like. They have an ulcerative colitis.
Okay, they say it's
Yeah,
a blood
so-
clot. And,
Yeah,
and
find out for me if it's ulcerative colitis that they have. Because that's a hypercoagulable state, meaning that it can predispose someone to clots. So just
Okay.
find out if it's ulcerative colitis.
okay, all right, thank
Yeah, you know how to contact me.
you.
Dr. Rita,
Yes.
this is Anna. Can you hear me? I've
Oh,
been
now I can hear you. Yes,
on
Anna.
a new system. My computer's messed up, but that's neither here nor there. So I'm having a hard time unmuting myself. My daughter has Crohn's and colitis. Her doctor has advised her for the last 6 years not to eat raw vegetables at all. And we
Right.
did a mini detox using the mucus cleanse for 3 days. And at the end of it, she broke out. But we'd heard, listening to Dr. Prince, I figured that's what it was from. That was bacteria coming out of her system.
Right.
So what would we do in the event, since her doctors are advising her not to eat raw at all? They've been telling her this for the last 5 or 6 years.
Yeah,
Because
so I would recommend that you start her on she finished 3 days.
yes,
I would start again. I would do the 7 days. She's got a lot of toxicity probably in her body. Is she on medication for colitis?
yes, she's on Stelara. But
Yeah.
we use the hemp MD, we use the Tachanga, we
Yeah.
use the pain cream, we use Dr. Rita's rub. We use it all.
Yeah, I would definitely detox her. I would
Yes.
definitely detox her. Yeah. I would juice some more.
Okay.
Yeah. And you know, you have to be honest with yourself, right? You have to be
Yes.
honest with yourself, and you have to look at yourself. Let's take your daughter out of it. Let's just pretend.
Okay.
Let's look at ourselves. And
Yes.
many of you on the line have comorbidities. You may have hypertension, you may have diabetes, you may, whatever you have. And you have to look at the American diet, and you have to say to yourself, well, where did it get me? Why am I sick? You ask yourself that simple question. Well, it didn't get me anywhere but sick, right? And for the research and data that shows that a plant-based diet has been shown to improve not only Crohn's, but improve heart disease and improve diabetes, improve cancer, right? She's gotta, at minimum, it may be a process, but at minimum, she's gotta stop eating animal protein, and she has to stop eating dairy.
Right.
That's minimum. And because it's been so many years, it could be very challenging for her to finish 21 days, right? That's like a lot. So start slowly. Let's first give up animal protein. Let's first give up all the dairy. Let's get that out. Let's just do fruits and vegetables. And then let's move to 1 day a week, she's juicing. 2 days a week, she's juicing. 3 days a week, juicing with a raw salad.
Okay.
But
Because now I did the 21-day cleanse myself twice, and I did the 7-day cleanse twice. This is since the end of December. I've lost 41 pounds.
Oh my gosh, that's amazing. Fantastic. And I know you feel great.
I feel wonderful.
Yeah, yeah. And we want your daughter to feel wonderful too.
Well, we've been blessed. So far, she's feeling good. I just want the Crohn's to level out. So
Right.
I'm trying to get her off the dairy and the meat because her blood pressure is AB.
Her blood type. Mhm.
Yes, her blood type. I'm saying pressure. I'm sorry.
No problem. Yeah, that's minimum. Let's just start. Let's start there.
Okay.
But
Okay.
we definitely have to get her off of animal protein and dairy. And then
Okay.
we'll detox her. If it's 3 days, it's 3 days. And 3 months go by, maybe it'll be 4 days. 3 months go by, we can increase it to 5 days. It's a process
Okay.
that I take my clients through. Like I have clients now that I'm coaching that want to become a raw vegan. Well, you just can't become a raw vegan, right? If you are used to meat and dairy, there's a process that has to go forth so that you can be successful.
Okay. We'll keep you updated.
Okay, wonderful.
Thank
Very
you so
good. I'm
much.
so glad you got to unmute because I saw your hand was up and you wanted to ask the question. And for everybody on the line, my email address is ritamd@wakana.com. So if you have questions for me, please email me. And Iola, I look forward to finding out if it's ulcerative colitis. Same thing for the ulcerative colitis, CVT. I would recommend the same thing. Get them off of animal protein and dairy. For some people, it's, easy for us because we've gone through it 1, 2, 3 times, 21-day cleanse, 7-day cleanse, right? But there's some people that you may not be able to start them like that. Start them with phase 1, right? Plant focus. But we've got to get them off of animal protein and dairy. I don't care if you have clots in your colon. You've got to get off the dairy and the animal protein. Okay, that's it for tonight. You guys are amazing. It's 8:56. Thank you so much for joining. I want to thank all of our guests, all of our business partners, all of our panelists.
Thank you.
Online.
Thank you.
Dr. Betty, our medical advisory board member. Have a good night. Be well, be safe, and continue to spread the good word that we have here at Wakana.
Thank you.
Thank you. Have a
Thank
good
you.